If you have a patient that has one or more of those, here's how you nail down the diagnosis. You walk behind the patient and you say, I'm sorry, but this may hurt a little bit. We'll find out. And you ask them to open their mouth widely, and you put pressure in the glenoid fossa with your fingertips, and then have them bite down on their back teeth in their normal bite, centric occlusion, as rapidly as possible with the pressure in the glenoid fossa. And if they say, ouch, that hurts, you have now nailed down the diagnosis, because normal joints don't hurt when you do that. Joints that are not inflamed do not do that when you do that. If you have a bad knee, if you have jogger's knee and you go to your orthopedic surgeon and you say, you know, my knee hurts. One of the first things the orthopedic surgeon is going to do, well, probably the second thing, first thing is to get some x-rays, which may or may not show anything. But what he's going to do is going to walk across the room, and he's going to take his hand and he's going to press on your knee, and he's going to squeeze it real hard. And if you go, ouch, he's going to know that the joint is inflamed. That's all he knows. And that's all he wants to know, the joint's inflamed. The temporomandibular joint, as I said before, is just a joint. It is not as special a joint as they try to teach in dental school. It has some special qualities, but it's a joint, and it works like all the other joints in the body, and it has the same characteristics, and it operates in exactly the same way when it comes to the neuromuscular system. So when you do this and it hurts, you know the joint's inflamed, you have just made your diagnosis. You hardly even need an x-ray, although I would highly recommend you always get an x-ray, a Panorex. You don't need a 3D, although if you got the machine, I know you want to find a way to use it. But the point is that a Panorex will do just as good, and you just want to make sure you don't miss anything. You don't want a big old tumor up there, or the sinus all filled up with crud, all kinds of things that you can glance at a Panorex and rule out. You don't want to miss anything, but you really make the diagnosis by listing out the symptoms and doing that little maneuver. And if it hurts, the joint's inflamed. If it hurts, you made your diagnosis of TMD.